Hi, October month is celebrated as Breast Cancer Awareness Month. So today we will discuss about some myths and truths about breast cancer. So it's true that most of the breast cancers happen in middle and older ages. But what we see is that breast cancer can occur at any age, especially before 50 years age also. So these young breast cancers are relatively aggressive, are found in higher stages, and are more common to be found out. It may be hereditary. So it's a myth that breast cancer cannot be found at a younger age. It's true that most of the 99% of cases can happen in females only, but the truth is that we see rarely some male cancers. So because males also have breast tissue and they can develop malignancy in that breast tissue, around 1% of breast cancer can happen in males. Having a family history is not essential to get a breast cancer. If we see only 4 to 5% or maximum 10% have a family history of breast cancer, and around 5% may among those can have hereditary breast cancers. We see in the population most of the breast cancer are sporadic, means they don't have family history, and even if they have family history, it may not be hereditary. All these things are very good in the sense they lead to a healthy lifestyle and they may help in reducing the risk, but adapting all these things while good may not totally prevent the breast cancer, because there are other factors which lead to the development of breast cancers. So adapting a healthy lifestyle may reduce the risk only and not totally prevent breast cancer. There are media reports or media statements that wearing a bra, especially the underwire type, may cause the stoppage of the flow of the lymph, which may lead to the toxic substances in the breast tissue, leading to the malignancy. But these are only myths. There is no truth about these, because there has been studies done in patients, in around 1500 women, where they found that there is no link between wearing a bra and the development of breast cancer. So we have not found any link between the antiperspirant use and the development of breast cancer. So some antiperspirants may have higher concentration of aluminum. So what was found that in these patients who chronically use these antiperspirants, there may be higher content of aluminum in breast cancer, but that does not essentially lead to the development of breast cancer. While a lump in breast can have maybe the initial presentation of a breast cancer, but essentially that doesn't mean it is definitely a breast cancer. There may be non-malignant lumps which we see more often in general population, but if you notice a lump in a breast, so it's definitely a sure-sight sign that you should consult a doctor so as to rule out a breast cancer, but that doesn't mean it is a breast cancer. It's again a myth. So unless we do a biopsy and first we'll do a biopsy to find out if it's a malignant, it's a cancer or a non-cancerous lump. Second, there are so many breast types, different types of breast cancer, that only biopsy will help us to know which type it is, because nowadays there is personalized treatment. There is so much different varieties get different sort of treatment. Some patients get upfront surgery, some patients get first chemotherapy then surgery, and some patients get targeted therapy, some patients get immunotherapy. So this all depends on which subtype of breast cancer in that particular patient is, and for that the only way to know that is through a biopsy, and biopsy does not spread the cancer. It's again a myth that smaller breasts may not develop cancer, but what we see is that breast size and cancer has no links between them. It may be smaller, it may be bigger. Breast cancer can develop any one of them. So it's again a myth that smaller breasts cannot develop breast cancer. So to conclude, I will say healthy lifestyle, annual breast self-examination at home, and regular screening mammography are the ways to prevent breast cancer. Thank you.